Welcome to Beyond Extraordinary, brought to you by LCMC Health. We are an 8-hospital system providing health, care, and education to the greater New Orleans area. We're a health system with 3 academic medical centers. Our AMC status means we have our finger on the pulse of the latest treatments and technologies in medicine, and we're bringing it right to our community. I'm your host, Kristen Gradney, Chief Wellness Officer. Today, we're joined by Dr. David Yu, Chief Medical Officer at Manning Family Children's. Dr. Yu has dedicated more than 2 decades to caring for children and families in our region as a pediatric surgeon, and now helps lead one of the nation's fastest-growing children's hospitals. Dr. Yu, thanks for joining us today. So to start, just tell us a little bit about yourself, your journey to becoming Chief Medical Officer at Manning Family Children's. And, what was your inspiration to become a pediatric surgeon?
Yeah, it's kind of, more about a journey of myself in this city, in this community. I came to New Orleans for the first time when I was 18 years old in 1994 to be a college student. Kind of found my way through college, inspired by the city and people here, and made the decision to stay for medical school. As I went through medical school, I knew I always wanted to work with children and be involved in pediatric healthcare. Didn't realize I wanted to be a surgeon until I actually got in the operating room and kind of realized what surgeons do and the care they deliver. And just out of happenstance, ended up getting assigned to stay at Tulane in New Orleans to do my general surgical training. And then Hurricane Katrina was kind of a transformative moment for me. I was going through my residency, learning how to be a doctor, trying to figure out how to fit in this diverse and wonderful community. And then when the tragedy struck, I think there were some people who weren't from here who decided to move on and not stay here. And I think a lot of people became invested in the city. It made them feel like home, made them feel like they wanted to stay and be part of rebuilding. And that's what struck me. And so since that time, I've really been committed to being here, being in New Orleans, and helping deliver pediatric health care. And so when I got the opportunity as I was finishing fellowship to look at jobs, I actually only applied for one. Going to work at, Manning Family Children's Hospital New Orleans at the time was the only place I applied to. Ended up getting a job here. And since then, I've just loved working here, being a part of this community. And then, just kind of a journey through starting as a surgeon, becoming the leader of the pediatric surgery service line, the associate chief medical officer for surgery, and now the CMO position. It's just been a wonderful journey for me and in this community over the last 30 plus years.
That is a beautiful story because it sounds like there was some, happenstance in there, but you were very strategic and you made decisions to stay and impact this community throughout and have just been committed to Manning Family Children's from the very beginning, right? Like applying for one job and here you are still today sitting before us as Chief Medical Officer.
Yeah, I think people who are born and raised here kind of understand it in their genes. Yeah. And I think for those of us not from here who end up here, some of us just kind of get bit by that New Orleans bug and just feel a part of this community, wanting to be here and take care of people here.
Yeah. So Manning Family Children's has tremendously grown and changed probably from the day that you stepped into that facility. And recently has celebrated several major milestones this year, including announcing a major NICU expansion, receiving national recognition for neonatal quality. What do you think is behind that growth and that momentum, and thinking about where we've been, how we've gotten there, and then what's your vision for the future of pediatric care here?
Yeah, I think, for the 70 years we've been a children's hospital uptown, Manning Family has been a piece of the community. I think it's been super important in delivering local pediatric health care. But I think about 15 to 20 years ago, there was kind of a movement towards how do we go from being a great local regional children's hospital to how do we become truly, a national recognized children's hospital that is offering all the same services at all the same quality as the other major children's hospitals around the country, and being a resource for Louisiana, the Gulf South, the entire region. And so I think that's been a part of our journey. And I think anyone who's been uptown certainly sees the construction that's happened. And if you've walked through the campus, now that we have the old buildings, the new additions, and then the wonderful addition of that State Street campus, and how that's all been brought together, has seen how we physically transformed the campus and the hospital. And then I think we've tried to do that from a service line standpoint too, and ask ourselves, what are the things that are being done at other major children's hospitals that we aren't doing here? So I think the trauma program is a perfect example of that. Prior to us making this movement to have a trauma center, which really started about 7 years ago, pediatric trauma was being done at UMC, prior to that Charity Hospital, and there really wasn't a dedicated site for children. And so we kind of set our minds to it, and it was wonderful. The LCMC system was kind of being built and being created around that same time period. So it allowed us to look at things not from two trauma centers, an adult one and a pediatric one, but how do we build a true trauma center where we're able to take care of all people, children, adult, and that gray area in between, and how do we build something really strong on both sides? So UMC was great partners with us when we did that. Started when we got our level 2 designation in 2023, and then added the teaching, the research, the additional clinical components to achieve that this year. And super excited about that. Major milestone for us, and I think it puts us in that conversation with those other major children's hospitals we're looking to be peers with.
Right. And it sounds like in the midst of this, vision for growth and expansion and destination care, you've really made the experience for families and patients at the center. Because even thinking about the trauma center, taking a step back, we don't want to just be great. We want to have this continuum.
Yeah, and then to tie it back to the other part of the question I forgot to answer last time. I think that's exactly the idea behind the new NICU. We built our existing NICU, about 20 years ago, and I think a lot has changed since then. Families being more involved in neonatal care, wanting to stay in the room, needing to stay in the room with the child to deliver the best care and get the best outcomes. We have 38 beds, but it's not as though we're just expanding from 38 to 60 beds. The rooms are bigger. They're going to be more inclusive of having families stay with these kids for long periods of time. We know medical learning has changed a lot in the last 20 years. And now, in order for a team to make rounds on a patient, it's not just 4 or 5 people standing together talking. It's computers, it's equipment, it's all these other things that go into the care of these kids that need to be in these rooms. So it's about more rooms, it's about bigger rooms, it's about rooms that allow for more family invested care in the kids. So all kind of the things you were just talking about.
Yeah, and I think you highlighted something interesting, the fact that while the patient family is at the center of our care, that we are also developing the next generation of healthcare providers while we're healing and caring and, doing all of these things simultaneously. I mean, that really speaks to the commitment to not only the patient in front of you, but the community and the growth beyond that.
Yeah, and I think one of the things we're super proud of at Manning Family is that integration of both our learning schools. We have both LSU and Tulane in our community, and both have played an enormous both current and historical role in developing positions in healthcare in the city, and bringing them both under one roof at Manning Family and saying, there's one place for academic teaching and training of medical learners here in New Orleans, and that's for pediatrics, and that's at Manning Family Children.
Yeah, that's awesome. So your team was also among the first in the country to provide groundbreaking FDA-approved sickle cell gene therapy. You recently celebrated, the region's and Louisiana's first patient to become fully functional and cured through this therapy. Tell us what that means, in the grand scheme of things. I think we're looking at it at a singular point, but what does that mean for not only these patients and their families, but, how does that transform healthcare in Louisiana?
Yeah, I think a lot of people know we have an increased incidence of sickle cell disease here in Louisiana compared to most states, similar to some surrounding states, Alabama, Mississippi. I think people may or may not have a lot of knowledge of sickle cell disease, but for many kids, and then as they transition to adulthood, it involves many stays in the hospital, 5, 6, 10 times a year. They need blood transfusions. The sickle cell crisis causes enormous pain, leads to things like heart attacks and strokes. And, I think Daniel Kretzy, our first sickle cell gene therapy patient, summed it up best, where he said, somewhere in his teen years, he kind of figured out how to move with it and adapt himself to this kind of life he lived, where he was in and out of the hospital all these times. You know, he wasn't applicable for many of the jobs he was interested in. And, you know, as someone who's only been in, you know, healthcare 20 years, you know, I didn't think we would see a cure for sickle cell disease in the time I was a physician. So the fact that this opportunity came, Dr. Ben Watkins, our director for bone marrow transplant and cellular therapies, had experience with this treatment where he previously worked in Atlanta. And part of the reason we brought him in was we knew we had to be able to provide this to the people in our community. This is where the disease is, and these are where the kids and young adults need this treatment. And so watching the process happen, we've only successfully done it in one child so far. Just amazing. Amazing for Daniel. Amazing for other kids and young adults with sickle cell in our community. Amazing for our state that, you know, I think so often when we talk about healthcare, Louisiana gets mentioned on the back end and not the front end where we could be. So I think this puts us in that light. Hope for all of these kids living with these diseases who are in and out of the hospital so frequently. And, you know, since the announcement 2 weeks ago, I mean, our phones have been ringing off the hook. And I mean, we have gotten tons of calls from kids in Louisiana, and locally we've gotten kids from I think we got a call from Ghana, all over the world. There was a kid who called us from Boston, where I think a lot of people would think, hey, there's a much bigger, more famous children's hospital there. But now they're looking to us to kind of play this role. And I think that's great. I think it's great for our community. I think it's great for the kids. And it's something we're really excited about at Manning Family.
Yeah, and you know, you mentioned hope, and I think that these are the types of moments that transform the community's view of healthcare, right? And that it's more than just, you know, a sick care and a palliative kind of approach. It's more of, you know, I have hope for all of the diseases, not only sickle cell, probably.
Yeah, and I think, you know, we're doing other complex treatment for other disease processes. We're about to do CAR-T for lupus for the first time on our campus. And I think what we hope to do is not only bring more of these curative gene therapy type treatments to Manning Family, but also even take it one step beyond and say, hey, we want to bring these therapies, but we also want to be part of creating these therapies. And how do we get on even the early end, where we talk about directing the innovation, being involved in the phase 1 and phase 2 trials? And I think that's kind of the next step and where we want to go.
Yeah. Tell us a little bit about ThriveKids, which is another approach to healthcare that's really outside of our four walls, really meeting people where they are and recognizing what the community needs and providing it.
Yeah, and I think, you know, there's a lot of different areas of pediatric healthcare in which disease prevention and being in the community are super important. And I think one of the things we realize is if we get the kids to Manning Family, we can have a positive effect on them. But there's tons of kids out in the community that are never finding their way to our healthcare, that have needs we don't understand, both traditional healthcare needs and behavioral healthcare needs, which we know is, you know, one of the epidemics of our time in adolescents and kids right now. And what better way to get access to these kids and what the issues they're having than being involved in public schools and where they are every day and in the community. And so, you know, we ask ourselves, how can we prevent kids from having complex healthcare diseases? How can we prevent them from traumatic injury? And this is kind of the outreach program to start that process.
And, you know, in some kids, you may identify that they have greater needs, to your point, and then they can enter into the healthcare system, which may have been more difficult before. An example of that, I think, is you guys have recently established the Gulf South's first pediatric pulmonary hypertension treatment and research center, which sounds amazing. And I think that part of the work there was recruiting nationally recognized physicians who have this expertise right here in our community. So again, you know, bringing what this community needs here. So tell us a little bit about that.
Yeah, and it all kind of comes together. You know, neonatal healthcare is getting better and better, which means more and more premature babies we're being able to take care of and are surviving long-term into childhood and adulthood. And one of the diseases that is much more common in premature children is having pulmonary hypertension, elevated blood pressure on the lung side. And there is no center for pulmonary hypertension in the South prior to us doing this, so nowhere in Louisiana, nowhere in Mississippi to go. And we had the opportunity to recruit two nationally known people. Russell Hirsch came to us from Cincinnati, and Michelle Sykes came for us with the University of Kentucky. And now we're able to build this program to provide this therapy for kids who just weren't getting it prior to now. And, we're putting them on medications to decrease their symptoms, extend their lives. And I think this is going to be another example of, kind of a quaternary care destination program that we're building for the kids in the region.
What does that mean for outcomes, like to have it here, right? If I live in Louisiana, my child is here, and now we can access this care versus having to travel 3 or 4 states. What does that mean?
Yeah, we talk a lot about that. And, I think if you're a millionaire, you can probably get your kid to any children's hospital in the country and get the care you need. But I think what we know is the majority of the kids we're taking care of in Louisiana aren't wealthy, and they don't have those means. And whether or not you have access to the best care for your disease shouldn't be a function of the zip code you were born in, or how much money you make. It should be something we're trying to provide for all kids. So that's our goal. We say we don't say no to any child at Manning Family, and we want that yes that we say to them to involve receiving all the best and most modern cares for whatever disease processes they have.
It sounds like you guys, are not only providing care in a way that provides clinical outcomes, but there's a human component here, right? Like really addressing needs that people have in a way that is felt, not just seen.
Yeah, and to tie it back to the original question, we have been on this journey in the last 15 to 20 years to ask ourselves, how can we become a national children's hospital and offer all the same services we did before? But we don't want to lose that component of being the neighborhood children's hospital who is a part of our community and invested in our families and our kids, and New Orleans and the Gulf South.
So across Manning Family Children's growth in trauma, NICU, gene therapy, ThriveKids, all the things that we've talked about, it seems like you guys have managed to balance innovation and access and created a culture that is really special there under the leadership of the CEO, Lou Fergoso, and he's helped drive that vision. So tell us what makes that special.
Yeah, I think there's a lot of CEOs of children's hospitals around the country that talk a lot about money. They talk a lot about budgets, and our culture isn't built around that. Our culture is built around really 2 concepts. One, delivering the best, broadest healthcare we can for kids, and then I think probably the most important aspect of our mission is that we don't say no to any child. Any child who needs us, the answer is yes, and then we figure out how to deliver that healthcare. And I think that's the culture that everything else stands on.
Yeah, kind of a magic bullet, so to speak, that you really keep the mission at the forefront, and the support and all the other things will come along.
Absolutely.
So that's great that Lou has committed to that, and I think we see the fruits of that now.
Agree, yeah.
We've talked about a lot. We've talked about all the great things happening. And as Chief Medical Officer, you're at the helm at a lot, most of this. And I'm sure that is a big job to do. So, one question that we ask all of the guests at the end of the podcast is, what do you do to keep yourself grounded and well outside of work? Because again, you have a pretty big job, Dr. Yu.
Sure. And, what I always tell people is, taking care of sick kids for a living. It makes it easy to get up out of bed in the morning. The mission is clear, and there is enormous satisfaction from the work I do. But it's also, being a part of the community isn't just about being a doctor at Manning Family Children's. It's about being part of the community, taking advantage of all the wonderful things New Orleans has to offer, the food, the festivities, all the things that we all love New Orleans for.
Thank you for listening, and join us on the second Tuesday of every month as we go beyond extraordinary.